A mother's intuition. Jade Bell knew something was wrong when she spotted these orange bumps and rashes appearing all over her daughter. She says doctors pushed her aside and even blamed her until she demanded a second opinion. And that second opinion and the treatment she got right here at the health system saved her daughter's life.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. We all have cholesterol in our blood, and high cholesterol is often blamed on an unhealthy diet or lack of exercise, but that's not always the case. You're about to meet a child whose cholesterol was so high, it was coming out of her skin. She was at risk of having a heart attack because of it.
They put the needles in and then they clean my blood.
10-year-old Aubrey Bell knows more about science and medicine than anyone her age should.
When I was 2.5, I got diagnosed with it.
She's had plenty of first-hand experience.
It's about 8.5 hours here and then it's 8.5 hours back.
And even though it's grueling driving to Kansas City every 14 days from their home in South Dakota, causing her parents to miss work and Aubrey to miss school, they feel fortunate.
There's a good chance I wouldn't have a daughter anymore if we weren't getting this treatment.
This therapy of aphaeresis is very rare in the United States for treating this kind of disease. Now we have the largest center in North America. We treat more patients here than all of Boston, New York, Chicago, LA, combined.
Aubrey has familial hypercholesterolemia, also known as FH. It's a genetic disorder that makes Aubrey's bad cholesterol sky high. Medication won't lower it. The only thing that works is this treatment, administered by Dr. Patrick Moriarty at the University of Kansas Health System. It's called lipoprotein aphaeresis.
The cholesterol goes down in the red bucket.
These machines filter the bad cholesterol from Aubrey's blood and then put the clean blood back into her body. But reaching Dr. Moriarty and his team was a 5-year-long process, even though the signs were there beginning when Aubrey was just 2 weeks old.
They just said it was probably a fungus or something.
Her mom, Jade, says she noticed orange patches developing on her baby's skin. She says the doctors in South Dakota told her it was because she wasn't bathing her properly.
It was frustrating that I was being blamed.
Over the years, the orange patches got worse, and still, she says, the doctors wouldn't listen.
It honestly almost looks like orange sherbet was the shade of the orange, and it looks like little bubbles, like kind of like a smaller blister.
It looked like an orange peel.
Finally, she drove 2 hours to a dermatologist in another town who correctly diagnosed the orange patches as xanthomas, and further testing revealed something horrifying.
He did do a biopsy and a blood draw, which her cholesterol was almost 1,000 at that point.
There was so much cholesterol in Aubrey's tiny body, it was seeping out of her skin, creating the orange deposits.
I always say go with your gut feeling. As a mom, you know when something is wrong. And unfortunately, sometimes we have to be our own advocate and push for the answers that we need.
It was Jade's persistence that landed them here for this treatment, a place where Aubrey is surrounded by a care team that has really grown to be like family.
They're so nice. They spoil me. Halloween, my birthday, Christmas, Thanksgiving.
And she has big plans for the future.
I want to move to New York and be a fashion designer.
We are so pleased to have Aubrey and her mom, Jade, joining us today from their home state of South Dakota. Good morning, ladies.
Good morning.
And we are also joined by Aubrey's doctor, Dr. Patrick Moriarty. He's the director of the Atherosclerosis Lipid Apheresis Center, it's a mouthful, here at the University of Kansas Health System, along with cardiologist Dr. Travis Love. Thank you both for being here.
Of course, our pleasure.
We appreciate you joining this conversation. Aubrey, first off, how are you feeling?
Good.
You look great. We know you still have those dreams of becoming a fashion designer. And more immediately, though, when was the last time, the most recent time you came here for your treatment?
I believe it was the 26th.
Yeah, last month.
So you drive, Jade, 8 hours plus every other week for your daughter's treatments, there and back. So that's 16, 17 hours on the road. How does your family handle such a huge disruption?
As a parent, you just have to do whatever you have to take care of your child.
Absolutely. I mean, that's the simplest answer, and you're such a good mom for sticking with it and trusting your gut when that first doctor blamed you. Do you have to miss work when you and your husband drive for those treatments? That's 2 days out of every week.
Yes, we do both miss work. He works a Monday through Friday, so he misses every other Monday. And I have a variable schedule, so I just schedule around our trips.
And Aubrey, do you have to miss school then, or your teacher's pretty understanding about it?
I do have to miss school. My teachers are pretty calm about it. They usually aren't mad or anything. They just get me caught up.
Do you have any of those orange bumps or signs of your condition right now?
No, they have all gone.
They're all gone?
Yeah.
That's wonderful. We have some more video of you getting the lipoprotein apheresis, and we just want to show our viewers again how this works. It's fascinating. So this basically filters the bad cholesterol out of your blood, puts it into these buckets next to you. What does it feel like when you're going through that?
While during the treatment, I can't really feel anything, but usually after, I am
pretty tired. You had mentioned that when we first met you, that you would take a long nap after each treatment.
Yeah.
How long is each treatment?
About 2.5 hours.
2 hours? And Jade, watching your little girl go through all of this, as a mom, what is that like?
It's hard. You never want to see your kids in pain or sick, but we also know it's what we have to do to make sure she's healthy.
Right. I want to bring Dr. Moriarty in. When we talk about the lengths that Jade and her husband have to go to get Aubrey here, and how far they have to drive, why is it so hard to find a place that does lipoprotein apheresis? Is this the closest to them?
Unfortunately, yes. Why I still haven't, we've been doing this at KU for over 20 years.
Right.
And as you heard, we have the largest center in North America. It just hasn't caught on in other major cities as much as you think it should. In Europe, particularly Germany, they treat 10 times more patients with this machine for patients like Aubrey and others, and they're 1/6 our size. So we're way behind in the sense of having this availability for patients like Aubrey and other young people.
And thank God it is available, because
yes.
Aubrey desperately needed this.
Yes.
You shared some images with us, and some of the images are from a paper that you co-wrote to show how successful that this treatment is. We have some before and after images of pre-apheresis and post-apheresis. Can you explain to our viewers?
Yes, the treatment lowers bad cholesterol. You know, there's two types. I mean, we need cholesterol as a species. We can't survive without it. But there's good and bad. And we're learning now that the bad, so-called LDL or Lp(a) really has no physiological need now as a species, and we need to lower it as best we can, because it will cause this kind of plaque formation in the arteries, which would then develop into a cardiovascular disease, which would require my colleague here to participate in treating that patient because of their cardiovascular event. So my job is to prevent them from developing it with these technologies, these machines, lowers the bad cholesterol from the plaque, stabilizes the disease as best we can. We don't guarantee immortality, unfortunately.
Right. And Dr. Love, you often refer patients to Dr. Moriarty.
Yeah, absolutely. Yeah, especially with the lipoprotein (a). You know, there's not a lot of effective treatments for it, and so when it's extremely elevated and people are at high risk for cardiovascular events, they go to Dr. Moriarty.
And we're going to get to Lp(a), lipoprotein A, in a minute, because that's a bit different from what Aubrey has, but so important. going to put a pin in that, get to that in a second. I want to ask you a question about Aubrey. Is she going to need to do this every 2 weeks for the rest of her life?
Hopefully no. Let me explain. She has what we call familial hypercholesteremia, or FH, which has the high LDL, the bad cholesterol in her blood. And she's what we call homozygote, meaning her mother and her father both have this disease, but they're heterozygotes. By bringing it together, she had LDLs of like close to 1,000. And she's 1 in 500,000 have this. But a heterozygote like the mother is 1 in 250. And
just 250 people?
Yes.
1 out of 250 are carriers?
Well, not only carriers, but have high cholesterol, like the mother does. But they're not as high as Aubrey. And there are new medications that we have. Aubrey on one medication right now. It lowers her LDL by 50% from baseline, but still not low enough. That's why she needs the apheresis. There is new technology coming on with a process called CRISPR. And these are companies that do gene modulation. And I'm working with one of them now on a protocol to treat these patients and change their genetic makeup so they don't make this high LDL, or in the case of the Lp(a), the high Lp(a). So that's the future, is gene manipulation for these genetic diseases of this kind. And that could be out 5-10 years, hopefully, in the future.
So Jade, you and Aubrey's dad both have high cholesterol, correct? Or you're genetically predisposed to having that?
Yes, we both have high cholesterol.
And then Dr. Morty, if I'm understanding you correctly, what they have combined is what created Aubrey's Aubrey's situation, which does anyone else in your family have what Aubrey has, Jade?
Not the same form. Her older sister has a single gene mutation, and then her younger brother has a single gene mutation.
So in the story, we saw Aubrey's cholesterol level at her diagnosis was nearly 1,000. What's a typical, Dr. Love, you see people on the front line. Is there a typical good cholesterol, bad cholesterol, or do you not like to get into that?
Yeah, no, there are typical numbers, but I tend to not throw the numbers around too much because I think people fixate on them, and these are moving targets. We move the goalposts based on your risk, your atherosclerotic disease risk, your prior events if you've had heart attack or stroke, and so I don't know that the numbers are as important. I think, you know, when it comes to what's normal, it's about talking to your doctor, your physician, about where they think you should be based on your risk profile.
So what's Aubrey's cholesterol at now? It was at nearly 1,000.
Yes, and now with treatment, we have her down to double digits.
Double digits?
Yes.
That's fantastic.
Yes.
Wow. So when we go back to the basics of what cholesterol does, is there a simple way to explain what does cholesterol do to your heart that makes it so bad for the heart? What's happening?
I think the simplest way to kind of show it is similar to that graphic that we had on the picture earlier. We talk about plaque buildup in arteries, and these arteries are throughout your body. They can be in your heart, in the arteries in your neck, in your legs, your aorta. And buildup of plaque in these arteries is really what we're talking about, kind of the end manifestation from the cholesterol. And that can ultimately lead to events like stroke or heart attack or pain when you use an extremity just due to lack of blood flow. So that plaque is really kind of the end result of these years of having high cholesterol.
And when we talk about good cholesterol and bad cholesterol, we have an illustration to show you, a video. Doctors, can you talk me through what we're seeing here? We got the bad cholesterol on the right, good cholesterol on the left, and what are they doing inside the artery?
The bad cholesterols you have there, this one being LDL, contains a lipoprotein called ApoB. And ApoB is the dangerous part of the bad cholesterol. And that deposits within the wall of the artery, as you saw there, and that yellow gunk that starts up initiates the process of atherosclerosis.
And that's when it builds up and just sticks in there?
And what can cause an acute event is not the plaque totally occluding, but the plaque gets torn. And like tearing of your skin, the first thing you bleed, and the next thing is you form a clot to heal it. And the clot actually causes the event. Now, the good cholesterol is involved with what we call reverse cholesterol transport, which takes out the bad cholesterol. But it's not that simple as that. We've learned now that all bad cholesterol is bad, but even all good cholesterol is not all good.
Oh.
It's a very complex story, and I think we don't have time to talk about it, but there's a limit on good cholesterol. Yeah. Actually, high good cholesterol, over 80 milligrams per deciliter, is actually been shown to be detrimental. And that's another story we can talk some other time.
Yeah, because that's going to scare a lot of people who aren't worried about their good cholesterol.
I know.
And that's something a doctor would let them know. They don't have to just look at the numbers and wonder.
You can break it down to certain things, particularly right now. The best way of looking at something called HDL particle number. And the higher the HDL particle number, the better the HDL functionality is. Because HDL is very complex. LDL has this ApoB, which dictates its functionality. HDL has about almost 100 proteins that bind and unbind, which can dictate its functionality. So it can change from doing something good to potentially doing something bad.
I start to see like hieroglyphics when you get into it. I'm going to have to.
It's very
study
complex,
it,
and let's move back.
But we'll go back to the bases.
Yes.
We'll put a pin in that because we're getting some questions about cholesterol right now.
Okay.
Quickly, Dr. Love, any basic advice for people who don't have a genetic problem or condition like Aubrey? How do you keep your cholesterol nice and low? What are like the top 3 things you recommend?
Yeah, so basic advice, but really the most important advice for people who don't have this genetic form, we're talking about just, completely based on diet, exercise, weight loss. I think those are the 3 things I would focus on to live kind of a heart healthy or low cholesterol lifestyle. So from a diet standpoint, you're talking about a more Mediterranean focused diet, or focusing more on healthy fruits and vegetables, whole grains, oily fishes, fish, I guess. From an exercise standpoint, moderate intensity exercise, 150 minutes over the course of a week, or 75 minutes of vigorous exercise. And then weight loss. Weight loss is very important, and you do that by having a healthy diet and getting regular exercise. So those are the things I think really it's important to focus on when you're talking about controlling your cholesterol.
And Aubrey's cholesterol, I keep going back to that number. As a non-medical background, 1,000 sounds frightening to me. Do you ever see patients with
1,000 is frightening.
That's
1,000
where
is
the alarms
frightening.
are going off.
We don't see that too often.
And I want to ask
rare.
Jade this.
1 in 500,000, I think you said.
1 in 100,000.
100,000.
A doctor initially blamed you and said you're not keeping your baby clean enough with those yellow deposits. That is enraging to hear as a parent. When you realized and were told by the good doctor what her cholesterol was at, what was your first reaction?
I knew that they were wrong, so I didn't take it to heart.
The doctor
I just
that blamed
knew I
you
needed
at first.
to.
Yeah. Doctors, is this something that every parent should be asking for their child to be tested for? Because I don't think my cholesterol was ever tested till I was in my 20s. Dr. Moriarty.
Well, the pediatric guidelines actually do recommend getting tested by around age 10 for most children. It's just not fully practiced in some places, and therefore it's delayed to longer and longer. But this is a chronic disease. It takes decades for this bad cholesterol that deposits in the wall to develop symptomatic disease or to require intervention by a cardiologist. And it's like someone with hypertension. You don't wait till someone develops heart failure or kidney failure from hypertension. You treat them right in the beginning to slow the progression of that disease effect. And the same thing should be with bad cholesterol in these patients, particularly with FH. Even if they're young and they're asymptomatic, starting now prevents the development from earlier to later, and being aggressive on treating the risk factors associated with it.
There's another genetic condition that Dr. Love talked about, lipoprotein A, or also known as Lp(a).
Yes.
So this is much more common than what Aubrey has, also genetic. Dr. Moriarty, how common is Lp(a)?
Unfortunately, unlike Aubrey, which is 1 in 500,000, and her mother 1 in 250, it's 1 in 5.
1 in 5 people has it?
In the world. And at some populations, such as Asian Indians and African Americans, it's 30% probability they have it.
So if you're an African American watching right now, you have a 30% chance of having this dangerous cholesterol.
And I recommend all my patients get checked, and Dr. Love does the same thing. And the problem with this cholesterol, unlike an LDL where diet and exercise can have a modest effect on it, there's no effect on diet and exercise and weight loss with this cholesterol. Once you're born with it, it lasts your whole life basically. It doesn't change that much. And because of that, in Europe and in Canada, they have their guidelines recommend universal testing for everybody at least once for Lp(a). We don't have that yet. It'll be coming, and the reasons are complex, but there are no official drugs, as Dr. Love mentioned, that are approved for treating it. The only treatment presently is aphaeresis.
So what percentage of the population is currently tested for Lp(a)?
Well, unfortunately, the recent publication came out of a California University medical system, published this past summer, and they followed 5 million adults, and it turned out to be 0.3%.
0.3% are tested
adults.
For something that 30%
yes,
has.
and then when they looked at patients who had known cardiovascular disease, it went up to 3%.
That's stunning because
it is. It's a simple blood test. Fasting's not needed. It's very inexpensive. There's ICD-10 codes associated with it. It's simple to do.
What does that mean, an ICD-10 code?
It's covered by insurance based on a code of you having family history of heart disease or family history of high Lp(a).
So you're nodding your head yes. You get people tested for Lp(a).
Yeah, absolutely.
And so why is it not happening in other places if we do it here?
Well, again, there aren't any official drugs presently approved for it. So some physicians, I'm assuming, says, why should I measure something I can't do anything about? But to me, I can't do anything about anyone's age.
Right.
But I want to know what their age is, because if someone at 25 compared to 65, the latter has a higher risk of developing events in the near future compared to the 25 based on their risk factors. So it's an awareness of higher risk that you could be more aggressive on treating other risk factors that are treatable. The good thing, there are two drugs. There are more than two, but there are two that are in phase 3 that we're participating here at KU. One's an antisense antibody to Lp(a). The other one is a RNA interference drug, and it lowers Lp(a) by over 90%. And
so there is something you can do about it.
Yes, and this new drug
on the horizon.
On the horizon. In fact, the study that's going on now is called Horizon.
Oh, interesting.
And the company's Novartis, and the drug will be a study that we're part of, will be finished hopefully in 2025. And if it shows benefit, then it'll be on the market for cardiovascular disease. But it's only going to be approved because the patients in the studies all have disease. So patients who don't have disease with high Lp(a), the drug won't be originally approved for that until much later.
Got it. So Lp(a), and this is something that's really was surprising to me, is a major factor in stillbirths, preeclampsia, and low birth weight. And you're telling me Lp(a) is not an automatically recommended test if you happen to be African American and pregnant?
Not necessarily, no. It's not.
Okay, well, we love getting our viewer questions because we're already getting quite a few of them. Make sure
but luckily, Aubrey does not have that.
Right, Aubrey does not have that. Aubrey has a different genetic condition. So we're talking about two different things here that affect. One affects Aubrey, and a small percentage in the other affects.
But patients like Aubrey, they actually have a higher probability than the general population. Normally, they're 40 to 50% probability of having a high Lp(a). But Aubrey's an exception to that.
Aubrey's just exceptional
yes,
in general. Can we acknowledge that? Aubrey is delightful. I just loved spending the afternoon with her when she was getting her treatment. She was entertaining, all your nurses.
Very entertaining.
Very sweet. We're getting a lot of great questions. You can send them to us on YouTube, the X platform, Facebook, and our email. We're pretty much everywhere. We'll ask them in real time. Yen Liang has a question. He wants to know if individuals with a familial predisposition, besides undergoing these kinds of treatments, are there any dietary considerations that could help them? I mean, Aubrey is tiny, she's active, she eats healthy. Was there anything she could have done to avoid this?
For her, parents? Not necessarily for her. I mean, as Dr. Love brought up, a good diet, exercise regimen, and so forth is always recommended for no matter who you are, genetic or non-genetic. It's helpful being in a healthy state for overall disease of all kinds, so it's important for doing that. But we tried medications on Aubrey, but because of her, she has what we call null receptors, so she has no receptors that respond to like statins or other drugs that normally lower LDL by this activity. She doesn't have those receptors, so they were absolutely worthless. They had no benefit for her.
So the best way to help her is to go in with this process and
with
clean
the
out her
aphaeresis,
blood.
yes. But now there's, like I said, there's a new drug class that we're using on her that lowers her LDL by 50% on top of what we're doing. That's how we got her down to double digits.
That's so incredible.
Yeah.
Paul has a question for you, Jade. Paul wants to know if you or Aubrey's dad have any signs or symptoms that told you had high cholesterol before Aubrey's diagnosis.
I did not. I never had my cholesterol checked. I had Aubrey at 21, so I was checked after we had her diagnosed. My husband's a veteran, so he did have his cholesterol checked, but with it being in the low 200s, they told him to exercise more and watch what he eats and all those things to lower it.
Jennifer has a good mom question for you, Jade, and I'm actually also wondering this as a parent. Jennifer writes, did you ever go back, Jade, and tell the first doctor who blamed you that it wasn't your fault? Did you ever confront that doctor? And then she went on to write, I could never forgive that. Neither could I, quite frankly.
I did inform the doctor, so I wanted it to never happen again. If a child came in with lesions like she had, that she was aware of how severe the situation was.
Were they apologetic? I'm just curious now if this was a showdown, or did they say, oh, I'm so sorry, we were wrong?
They pointed out that they made a mistake.
Okay.
And they really didn't think that it was anything as severe as it was.
Wow. Becca has a question for Aubrey. Aubrey, Becca wants to know if you've ever had to miss out on something really important at school because of your treatments, and she wants to know how you handle that.
I've had to miss out on a couple concerts. Like we usually have like some special day, like mess up days or something.
You missed out on a concert?
Yeah, I've missed out on a couple of my school concerts.
Oh.
But I always I just know that there's always I can always have a concert, and just know that there's also next year.
So some fun stuff you got to miss out on. Jenny wants to know, how expensive is lipoprotein apheresis? You had mentioned insurance covers this, correct?
Yeah, it's covered by insurance. It's covered by Medicare. It's FDA approved. Like I said, it's the only approved therapy presently for Lp(a), in addition to FH. It's also been approved for a type of kidney disease now.
What kind of kidney disease?
It's a specialized kidney disease. It's more nephrotic syndrome-like. And it was the data was done in Japan, actually, that was presented to the FDA. And the FDA was so impressed by it because it's not being treated presently effectively with other therapy that it got approved. So we've been treating a few patients here at KU, some children over at Children's Mercy who have pre or post kidney transplants. It gets this focal segmental glomerulosclerosis. It gets the kidneys get dysfunctional after or a transplant, and the mechanism is still not fully understand how this develops in these patients. But the apheresis seems to help somewhat in stabilizing the disease.
Wow. And I also want to point out, Dr. Moriarty, you treat more people here at the health system than Boston, LA, Chicago, and Philadelphia combined.
Yes.
And everyone's coming here for this.
Well, just locally here.
Yeah.
I mean,
Yeah.
except for patients like Aubrey, but we
Right.
have patients from western Kansas and so forth. So you can imagine how many patients are potential candidates in Chicago, LA,
Right.
New York, Boston, and so forth that need it and are not getting treated.
I want to bring our whole panel back in for some final thoughts from our guests. And Jade, I want to start with you because you have such an important message that you've really stressed when talking to me about the power of a mom who persists even when someone might tell her nothing is wrong with her child.
Yes, trust your mother instinct. It's always right.
Amen. It doesn't get any more clear than that. And Aubrey, what are you looking forward to most now that you're feeling better and you're getting to space out these visits a little more?
I'm looking forward to doing sport more often and a little bit more exercise and doing more things with my friends that I wasn't able to do when my cholesterol was so.
Aubrey, what's your favorite sport?
Gymnastics.
Gymnastics, uh-oh, that's a nail biter for parents. Do you like watching her do that, Jade?
I don't understand how she does some of the things she does.
Right. She's a brave little girl, though. Dr. Moriarty, you're incredibly passionate about this treatment and making sure people have access to this. What's your dream when you look into the future?
Well, that more patients that are needing this get treated in the United States, but also the future of new medications, and maybe this gene therapy that's being investigated by these companies will be a future for treating genetic diseases more extensively than they are now.
And Dr. Love, one thing that we've talked about is the misconception that it's always what you eat and how thin you are. And people might think they're in the clear because they eat healthy and they're not battling a weight problem. What's your message to people watching?
Yeah, I mean, at the end of the day, you just can't outrun genetics, and so it's really important, you know, to be checked and be cognizant that this is a real issue that can affect you later in life, even if you don't feel that there's a problem now.
So always be your best advocate and ask us to get tested. We love sharing the incredible work that our doctors do right here at the health system, like Dr. Love and Dr. Moriarty, but we also love showing you what life looks like for them outside of the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, we're going to start with Dr. Love because you have 3 human beings you're very passionate about. Tell us who these cutie patooties are. That's what they call the kiddos.
Yeah, for sure. My 2 sons, my older one there, Grayson, and my younger one, Jack, and that's my little daughter. She's about 16 months now, so that's an older picture, but her name's Elizabeth. We call her Birdie. So
Birdie, I love that.
Yeah.
It's so sweet.
Cute.
Now, when do you sleep?
Very rarely. My wife does all the heavy lifting. Work is kind of an escape from the 3 little ones. So.
Right. Good to give her a shout out. What's her name?
Ashley.
Ashley. Okay, Ashley. We need a picture of Ashley next time.
Yeah.
We're going to keep bugging you for a picture of Ashley. Dr. Moriarty, tell us about these pictures. Who is in your arms on the picture on the left?
That's one of our grandchildren. That's my wife. And to the right I've come from a family of 10.
You have 9 siblings?
Yes.
Where are you in that birth order?
I'm number 5.
Right in the middle.
And I had 8 sisters.
Whoa!
And I'm from Massachusetts originally, so they're all over the country. And I had my 70th birthday last year, and actually about half of my family showed up. That's only half.
Wow.
But it was a great time. They loved it. Kansas City. We went to the museums, and they had a great. That's Jack Stack barbecue. They had
good choice.
Yes.
Good choice.
Yes. So it was a lot of fun.
Are you a family of doctors?
My father and my grandfather are doctors. Yes.
Okay. Yeah.
Yeah.
And you carried on the
It looks that way. The rest.
Are you the only one?
Yes, I'm the only one.
Does everyone
My brother
call
was
you?
smart. He went into business.
Oh, right. That's so sweet.
He was an accountant.
Well, thank you for sharing that. And thank you both for making time to be with us today. I know you have patience to see.
Thank you, Aubrey. And hopefully I'll see you in New York City as a designer.
Oh, yes. I can't wait to see Aubrey's latest fashion. Aubrey and Jade, thank you. Coming up next week on All Things Heart, a Christmas miracle for a retired nurse. Archie Moore joins us as the 1-year anniversary of getting her new heart approaches. How she's celebrating Christmas this year with her 13 grandchildren. That's Thursday at 8 a.m. Coming up on the Morning Medical Update, Kristen Halpin watched her mom collapse and she knew what to do. I'm Alexis Del Cid on the next Morning Medical Update, the life-saving act that earned Kristen an award and set her mom on a new mission. Friday at 8 a.m.